Hi everyone, this is Nick Zupan with the Rock County Public Health Department. I'm the epidemiologist here on staff, and so part of my job is looking into all of the data related to several different health topics. And I'm here today. We're going to do a little session. So this session is called Numbers with Nick. We're trialing a little Facebook Live video session for everyone. So we're going to go through and talk about some of the data that we're seeing recently related to COVID-19 and talk about some data. We can answer some questions. Feel free to put some questions into the comment section. We might not get to the questions, answering those questions today. We're kind of still trying to figure out the logistics behind this Facebook Live video presentation, but just wanted to provide some basic overview of the data that we're seeing recently, and hopefully you find this helpful and informative. And please just let us know if you do have questions or comments. So I'm going to jump into the data. And one of the things that we've been putting out on our website is related to the Rock County Reopening Dashboard. Now, some of you may have seen this on our website, and I encourage you to go to co.rock.wi.us/public health. And you can take a look at our COVID-19 page on the website there. We have a number of different reports. So the data that I'm going to go through today is part of our Rock County Reopening Dashboard data. Just to provide a little bit of context to the data that we put out on this dashboard, and hopefully throughout my presentation here we'll be answering some of your questions. If you have additional questions, you can leave that in the comments box, and we'll try to answer those questions in subsequent video segments. So with that, I'm going to jump right into the data. So the first measure that we look at in our Rock County Reopening Dashboard is percent positivity. I'm sure a lot of people out there are fully aware of what percent positivity is, but for those of you who haven't heard this term before or are not so familiar, this basically means when we look at everyone who's being tested for COVID-19 in the community, we look at how many people have tested positive and how many people have tested negative. And we take the number of people who have tested positive and divide that by the total number of people who have tested for COVID, whether positive or negative, over that time period. So when we look at our Rock County Reopening Dashboard metric for percent positivity, we look at the last 2 weeks of data, and we try to figure out how many people have been tested in that time period and how many people tested positive. So the data that we've been looking at basically runs from Wednesday of 2 weeks ago through Tuesday of this week. And so, I realize that it's Friday, it's the 16th of October, and the data that I'm presenting runs from September 30th through October 13th. So when we look at our percent positivity over the last 2 weeks, we are at a 21.81% positivity rate. So that means just under 22% of all the tests that are being done in Rock County around this time in the last 2 weeks are coming back positive. The reason that we use this metric is, one thing is it's a common metric used across the state of Wisconsin and nationally to get a sense of what the spread is like for COVID-19 in a given community. We're using this information. The data comes directly from the state of Wisconsin Department of Health Services, and we take this information and we push it out on a regular basis. But this information, we have to take this with a grain of salt. Sometimes the total number of tests reported in the last 14 days does not actually reflect the total number of people who are being tested. And this is due to a number of factors, including lag times in when we get the results of people being tested and things like that. So we do have to take that with a grain of salt. We don't rely solely on just this one metric, but it is an important metric. When we look at the percent positivity over time, you can see the graph down here at the bottom where we have some peaks and valleys. So at the start of the pandemic, we're looking at about a 5 to 6 to 7% positivity rate. We had a small spike in late April and early May, and many of you probably remember this. There were a number of different cases of COVID-19 in the community at that time. We had about a 15% positivity rate at its highest there at that time. Then around July 4th, we had another small peak where about shortly after July 4th, there were about 7.5% of our tests were coming back positive. And since September 1st, you can start to see the climb in percent positivity over these weekly periods. We're seeing, well over 10% into the 15s, and then recently we've jumped above 20%. So, this is an important measure that we're keeping track of, and we really want to make sure that, these trends don't continue. Especially, when 20% of the tests are coming back positive, that means that there's a lot of COVID spread in the community right now. So that's the percent positivity metric that we're looking at. I'm going to move into the number of tests that are being reported to the health department each day. So again, this information comes directly from the State of Wisconsin Department of Health Services. They report on a daily basis the number of positive and negative tests that have occurred, and those results are reported to the health department. And so what we try to do is take a look at the total number of tests that are being done and average this across a 14-day period to get basically a metric of the number of the estimated tests being done in a given day. So over the last 14-day period between September 30th and October 13th, we had 287 tests being conducted per day. Now I expect this number to increase as we have our community testing site in Janesville currently. We have yet to see that data come in terms of being reflected on this graph, but as soon as that data becomes available to us, we will be pushing it out onto our website so that folks can get a sense of how many tests are being done per day. It sounds like currently at that testing site, there are 500 tests being done per day, and they are seeing lots of interest and lots of participation in that testing event. The metric that we've selected, or the reason that we select this metric in looking at testing availability is we want to make sure that there's adequate testing in our community to basically identify or catch all of those COVID-19 cases out there so that we can take the appropriate action to make sure that that disease is not spreading from person to person. If we don't know who has the disease, we won't be able to isolate those individuals and make sure that they're not spreading it among their community members and their neighbors and their friends. So that's why we use this testing metric. The goal is we're trying to make sure that our testing levels stay above 240 tests per day in Rock County. And the reason that we selected this measure is it's based from research that comes out of Harvard, where they basically set up a number of tests that needs to happen in any type of community for adequate surveillance of COVID-19. We used the rates that they had put in place through their study and basically projected that onto the Rock County population and came up with 240 tests need to be conducted per day in order to adequately understand where the virus is in our community. I'm going to move on here and just share a little bit about some other metrics that we're looking at when we're thinking about the spread of the illness in Rock County and how we're able to handle the spread of the illness in Rock County. So unfortunately, we're in a period of pretty high COVID activity, as you saw with the percent positivity. We are also tracking how our hospital systems are managing the spread of COVID and whether or not they're adequately able to provide care for the patients that they're seeing who have COVID and otherwise. So the hospital systems are asked 4 questions, and they're asked to report on these questions regularly. The questions include, do your staff have adequate testing availability if they're symptomatic? Basically, are hospital staff being able to be tested for COVID-19 if they need a test? Thankfully, 100% of our healthcare systems here in Rock County have answered that they do have adequate testing for their clinical staff if they need to be tested. The hospital systems are also answering the following questions and affirming that they do have plenty of space within their hospital systems to treat their patients. They have plenty of staff to treat their patients, and they also have the supplies to treat their patients. These metrics are important to keep tabs on because we want to make sure that our healthcare systems can adequately provide care for both the COVID and non-COVID patients that they see on a day-to-day basis. If we have a large influx of patients needing care for COVID-19, that could potentially strain our healthcare systems and create problems down the line. Another metric that we include in our reopening dashboard relates to the number of healthcare workers who have tested positive in the last 14 days. Now, this data again comes from September 30th through October 13th. And basically, we've seen 15 new cases in that 2-week time period of healthcare workers who have tested positive. Now, these don't necessarily mean that they're healthcare workers only in a hospital setting. These could be healthcare workers in a nursing home or a rehab center or something like that. So the reason behind tracking the number of healthcare workers who represent positive cases is that, again, we don't want to see a strain on our healthcare system, whether it's at the hospital level or the nursing home level. We want to have adequate staff people to care for the patients that they have. And if we have staffing shortages, that means that people aren't going to be able to receive the care that they need. So we, in addition to those hospital metrics that I just shared, we also want to make sure that we're keeping tabs on the number of healthcare workers in general in Rock County who have tested positive. So 15 is a little bit higher than we had seen last week. Last week we were at about 6 new cases among healthcare workers, and we're keeping tabs on this on a weekly basis to make sure that we're not trending in a very bad direction. Another metric, again, relates to our hospital resources. It gets a little bit more in detail in terms of some of those supplies and critical availability of some of the hospital resources. We want to make sure that there is adequate services available for people both who have COVID and don't have COVID but are needing treatment at our healthcare facilities. So in that 14-day period, it looks like that there were 70% of ICU beds available. An ICU bed is a bed that's reserved for someone who is severely ill. So ICU stands for intensive care unit. Basically, some of the patients who have gotten sick with COVID have required intensive care because they are so severely ill. And we want to make sure that there are enough of these beds available if there were potentially changes in the number of severely ill patients. We also take a look at the number of ventilators that are available on a 2-week period. Again, this is to make sure that we can ensure that healthcare resources are available for these patients if they need them. I'm happy to report over that 2-week period, there were 78% of ventilators available when we averaged that over the last 2 weeks. And then finally, we want to keep tabs on the percent of medical surgical beds available. So these are your general hospital beds. They're not to the level of intensive care beds, but if someone is very ill with COVID and they need to spend some time in the hospital, they may be put into a general medical surgical bed. Again, we want to ensure that there's availability for COVID patients and non-COVID patients. Any kind of strain on the healthcare system could be a serious problem for those who are ill with COVID and those who have other medical conditions. Another metric that we use when we're looking at the status of COVID-19 and kind of how things are going in Rock County is a contact tracing metric. We try to keep tabs on how quickly health department and state contact tracers are able to reach people who have been identified as close contacts to confirmed cases of COVID-19. The reason that we follow up on these folks is we want to make sure that anyone who has been in close proximity to someone who has tested positive, make sure they know how to protect themselves, their families, and their communities from continuing the spread. There have been situations where people who have been in close contact with known cases of COVID-19 have developed symptoms and tested positive themselves for COVID-19. The way that the virus spreads generally is through close contact between individuals. And so we want to make sure as a health department and as a community that we're identifying people who have been in close contact with known cases and providing them information about how they can protect themselves. So the metric that we use is the percent of these close contacts that we are reaching within 48 hours over the last 14 days. And the date range that I'm using here is September 30th through October 13th. Our goal is that we are reaching 75% or more contacts within 48 hours. Most recently, we are reaching 49% of those contacts within 48 hours. We have seen this over the course of the pandemic. When there are more and more cases, there are more and more contacts. And when that number grows, it becomes more and more difficult to follow up with all of the contacts that are out there. The important point is that we strongly encourage that people limit their activity in public. Try not to go out of your household. Try to stay in your household as much as possible. And I know this is difficult and it's a lot to ask, but it's really important that we minimize the amount of contact that we're having with individuals in the community, because this virus can spread very rapidly when we're in close contact with people who are outside of our household. We're seeing a lot of cases come from parties and gatherings and folks getting together with folks who are outside of their household. And that's one of the reasons that we're seeing such drastic increases in our COVID-19 cases recently is the wide amount of contact that people are having with individuals outside their household. The final number that we look at in our reopening dashboard relates to the number of people who are seeking care for COVID-like symptoms. So this is we're looking at basically when someone goes to their healthcare provider, whether it's their primary care provider or the emergency room or urgent care, and they say they have symptoms like respiratory distress, trouble breathing, shortness of breath, cough, fever, any of these kinds of symptoms, and they see their provider regarding these symptoms, they're going to be counted as someone who is seeking care for COVID-like symptoms. So these aren't necessarily people who are exactly testing positive, but they're displaying symptoms that are similar or consistent with someone who might have COVID-19. We have been tracking this information over the course of the entire pandemic, and we're starting to see an increase in the average number of people who are seeing their healthcare providers over a 2-week period. For a long time early in the pandemic, we were seeing maybe 5 to 10 on average patients per day who are seeking care from their providers for these symptoms. Most recently, we're up to close to 30 people per day going to their healthcare providers seeking care for these types of symptoms. And so that again is another indicator that there is widespread COVID activity when we're seeing a lot of people present to their healthcare providers with symptoms that are similar to what COVID-19 would display. So those are the metrics that we're including in our reopening dashboard. We look at all of these metrics in combination as a health department when we're making our decisions. We also take a look at, we take a look at the data and we communicate with our healthcare partners and our other partners across the community to make these decisions. And so the data is not driving the decision making, the data is informing the decision making process. So I'm going to stop there. I really appreciate everyone's time and viewing this presentation. We are going to try to get my video up the next time we do this so that you can see my face as I'm talking through this information. But thanks everyone for joining us for this Numbers with Nick segment. We hope to get some questions from the comments, and we'll be addressing those questions through future streams. But at this point, I just wish everyone to stay well and healthy, and we'll see you next time.